In healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share a nursing perspective without taking up too much of your time. If you've been here before, then you recognize our guest is Dr. Nayo Wills, or Dr. Nayo. She is going to be talking to us this time about functional medicine and understanding hormones and hormone therapy for women. If you didn't already, we invite you to go back and watch her first episode, which we dedicated to men. Today, we'll be going over what are hormones, common diseases, signs, and symptoms associated with abnormalities in hormones for women, and what your experience will be like in getting diagnosed, treated, and evaluated. We'll talk about what we call contraindications, or situations where perhaps you're not a good candidate for hormone therapy, common misconceptions that she finds in her patients or even out in the public. We're going to try to address some of those, and where you should start if you might be interested. If you're new here, we welcome you to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co-hosts here at the Melanin Initiative, along with Alicia and Geraldine, who send their love in their absence. We are a health literacy podcast. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and then to use that information to go back and manage your health, as well as advocate for others. By watching on YouTube or listening on your favorite podcast app, it's our hope that you feel empowered to ask questions, educated on how you can manage your health, and confident to navigate the healthcare system. If you haven't already, we invite you to subscribe, whether you're listening on your podcast or on YouTube. There's usually a button or a thumb up that you can hit, as well as a bell that'll let you know as soon as we posted a new video. You can leave a comment and let YouTube know that this is important, so that when people like you look for information like this, it'll show up much higher in the results and it'll get their attention. Remember, this show is for educational purposes only. The opinions expressed here are our opinions alone. They are not a representation of any of our affiliations. If you're experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you're having a physical emergency, you can call 911. If you or someone you know might be having a mental health emergency, you can call 988. Welcome back, Dr. Nayo.
Hi, how are you, Dr. Kimberly?
Wonderful. We thank you so much for coming back to share your expertise. We're going to invite everyone to go watch your first episode so they can hear a little bit more about your journey. But if you could just give us a quick little blurb on who you are, where you're from, what you do.
Absolutely. So I'm Dr. Nayo. I'm a functional medicine doctor. I'm board certified in internal medicine, which just means that I am a part of an organization where you have to keep up a certain standard and testing and learning in order to stay certified. And I am also certified in functional medicine. I practice in the DC area, and I just love really supporting people in learning how they can be well.
We love it. And so you've already told us about what functional medicine is and how it differs from conventional medicine. And so you can all go back and listen or watch that in her first episode. Today, we're going to jump right into it and talk about what are hormones in women, at least when we're talking to women.
Absolutely. So as we spoke about last time, Dr. Kimberly, a hormone is a chemical signal that tells another part of the body downstream what to do and when to do it. So this hormone signal in women, let's say that we're talking about hormones specifically for sexual health. So a hormone signal in the brain then tells the ovaries what hormones to make and when. And this is very complex with women because we have multiple hormones. Depending on where we are in our reproductive life, what we're making, how much we're making, that varies. So it's a really brilliant system that we have that really is here to serve us.
Wonderful. And I didn't really do a good job of it in the first episode, but when we're talking about women, we're talking about those born biologically as a woman. So even if you identify as transgender male, but you haven't had any gender affirming therapy or procedures, this conversation still applies to you. And it's very important that you share your identity with your provider so that they can educate you appropriately on risk factors and treatments and what is and isn't appropriate for you. So what are some common diseases, signs, and symptoms when we start talking about women and hormones?
That's a great question. So earlier on in a woman's life, so obviously before puberty, The hormones are still, figuring out what they're doing in the system. Once a woman or a young lady starts menstruating regularly, then she should have 2 phases of her menstrual cycle. So the first half is what we call the follicular phase, and the second half is the luteal phase. This first follicular phase is governed by estrogen, and predominantly a hormone called estradiol. That is what's making it's, I refer to it as a building hormone. So it's building up the lining in your uterus. It's preparing the egg or the follicle that could potentially be fertilized by a sperm. And it also has activity in the breast as well. So that's first phase, estrogen or estradiol. The second phase is progesterone dominant, and that is progest. So for gestation. So that is the hormone that is going to support one, ovulation, which is what would start the possibility of actually getting pregnant. So that means it's telling your body to release the egg, and then your progesterone that your ovaries are making until you actually develop a placenta with the developing embryo fetus. Progesterone is the hormone that, if you had a fertilized egg, will support the implantation of that embryo until, like, as I said, a placenta developed. So it's supporting the growth of an embryo and ultimately a fetus. Now, if someone does not get pregnant, progesterone, it's the fall of that hormone that actually causes the cycle. That's the signal to your uterine lining and the rest of your reproductive system. Nothing has taken place in terms of an egg being fertilized and implanting into the uterine wall. So it falls, and then that lining sloughs off, and that's what you see when you see your period, the sloughing of your uterine lining. And that's in response to the fall of the progesterone. Now, they're both very important because estrogen, as I said, I think of that as a building hormone. Progesterone is not just for pregnancy. It also is really important in helping to provide the necessary balance to estrogen. So I call it like a modulator. So it either can support growth of things or the sloughing off of things. So it keeps estrogen in balance. So you need that yin and yang activity that keeps them both in balance. So those are kind of the 2 hormones you'll hear people talk mostly about that govern your menstrual cycle. And then I have to give a mention to testosterone. So we classically really think about this as a men's hormone. It's very much important to females as well. It's actually the most, the highest in circulation in the hormonal system of women. And we don't really know that. But testosterone is actually the largest, available in the largest amounts in the body. So testosterone is very important, as I said in the podcast we did for men, very important for brain health, mental health, focus, motivation. It's breast protective, as is progesterone. It very important for bone mineral density, maintaining and building muscle. So it's a really important hormone for women as well. And it's not often recognized as such because it's not involved in those 2 phases, or I should say regulating those 2 phases, but it does play a role. It peaks mid-cycle as well. So those are the 3 hormones that we speak a lot about when we're talking about hormone therapy for women.
Wonderful. And what kind of changes do we see over time with aging?
So as women get on in years, so usually it's changing, just as I said with men. We're starting to see the change into perimenopause earlier for some women, especially those who aren't taking the best care of themselves. We're now starting to see that late 30s, early 40s. It is a long period. So most women don't even know that they're in perimenopause until they're toward the latter part of perimenopause. But as both of those, or all 3 of those hormones decline, so progesterone and testosterone start to decline first for most women, and estrogen is the last to go. So the symptoms you're going to experience is really going to depend on the makeup of the hormones that you have and the levels that you have of them. So you can see with too much estrogen, you can see more PMS when you're younger. You can see fibroids, endometriosis. So a lot of growth of tissue and stimulation of things in a way that is in excess because of excess estrogens. And a lot of that is coming from our environment. So what we're taking in our water supply, our food, a lot of the topical products, cleaning products, drinking out of plastic. That is really what a lot of the changes in hormones, especially in women, but men too, that we are seeing. So PMS, endometriosis, fibroids are some of the top ones you'll see in the younger women. Later on, you could still have all three of those, but as the progesterone starts to drop a little bit more, you can see some of those a little bit more, especially PMS, a little bit more exaggerated. You can also see sleep not as great as progesterone falls. And then you can kind of see the timing of cycles changing more and more as the progesterone drops off. Testosterone, you're going to see more libido issues, perhaps not as strong of or an easy time having an orgasm. You can start to see loss of muscle mass or more difficult time maintaining it. And then with all the hormones dropping, insulin resistance is a big thing that we see with the loss of hormones, more belly fat. And then once estrogen drops is kind of when you start to see the whole picture. So estrogen has a huge effect on the brain, as do all three of the hormones. All three of them stimulate something called BDNF, brain-derived neurotrophic factor. And this is a natural hormone signal in our brain that tells our brain to make more nerve tissue, so brain tissue. Estrogen, progesterone, and testosterone do that. Meditation does, incidentally, too. So that's just a little freebie. But all three of those hormones have huge impact on your brain and the health of the brain. So your cognitive function, how easily you think, how clearly you think, also mental health, as I mentioned. And so you'll start to see as all three have dropped off, more sleep issues, mood issues, and your mood is more labile. So it's all over the place. So more mood swings. And it doesn't have to be. So I don't want to put this out here like if you're in perimenopause, this is going to happen. That's not what I want to be saying, because that's not correct at all. But you'll start to see more issues in the sleep department, the mental health department, the cognitive function department, muscle loss, things of that, if you haven't done the things to really take care of yourself.
Ooh, perfect question. What can we do to take care of ourselves?
The number one is that I'm always going to tell everybody is first have a spiritual connection. If I could tell people what that does, it would be the most expensive medication out there. And followed by that, to support that, I would say meditation. They literally have studied this. They have shown that people who are long-term meditators, they bring down the inflammatory markers. They have an easier time balancing the hormones. They bring down and stabilize stress hormones. And stress is one of the biggest drivers of earlier and more severe hormone imbalance. Because most of us remember our grandmother and even our moms did not complain of, the hormonal issues that women now are. And I think a lot of it is, some of it's the toxicity, but some of it's being overscheduled and spread too thin and not prioritizing connection with whatever your higher power is and taking the time out for mindfulness.
You have brought up so many good points, and you're definitely speaking to me when you talk about being overscheduled. But I love that you brought up the importance of meditation and that you're bringing it up in this environment, because so much, I think, is given to other situations and how it can be beneficial. And so I love that you brought that up. And I love how you keep coming back to this centering and this spirituality too. I really like that. Do your clients mention anything about that to you when you start bringing that up? Do you get pushback, or they're pretty open to it?
No, I don't push it on people. So I kind of feel folks out. And if it's something that they're open to, then we'll speak about it. If that is not your thing, no problem. Because I want to meet everybody in a place that's comfortable for them. I just can tell you over the years, and it's been 16, 17 years now, personally, and in all of my clients, the changes people make when they address stress, address sleep, connect to a higher power, it's unparalleled. So, yeah.
On the I don't know, evidence when it comes to the meditation, is there like a minimum of when you should do it, or any sort of anecdotes around that?
I just tell people to start doing it, because when you start to tell folks 20 minutes twice a day, it's too much for people who are busy, and, especially folks who have kids, or they may be helping their parents, or just, like I said, overscheduled in whatever way they are, to ask someone then to do, it's just too
Another
much.
thing. Yeah.
So I just say start, and
Okay.
just, even if it's 2 minutes first thing in the morning. I love using an app. I use Insight Timer app. Some of my clients use Calm, some use Headspace, some go to YouTube, some just breathe. Whatever you can do, just start 2 minutes, non-negotiable every morning. It impacts every single aspect of health. So I would say just start there. A lot of the data is on folks who are doing up to 20 minutes once or twice a day or longer. But the thing that I hear from my clients who try, and why they don't continue, is their mind races. That's what happens. You know what I mean? That's the natural thing that what I call our monkey mind wants to do. When you're trying to sit down and center, it wants to have you thinking about what you need to do in your day, and you forgot this and you forgot. That's okay. Like, don't make yourself wrong about it. Just breathe and just come back to the present moment. And the more and more that you allow that monkey mind to do what it does without judging yourself, and just breathe, it starts to quiet down and cooperate after a while. It may not go away completely, or it may, but don't let that be the rate limiting step. Because I sat with a yogi once years ago, and she said just the act of sitting down and meditating actually helps you to release a lot of the stress hormones and inflammatory kind of jarring biomarkers, or chemicals circulating in our body, just sitting down and willing to, like, hold that moment, irrespective of what your monkey mind is doing. So don't make yourself wrong about it, and just keep doing it.
Thank you. I love that monkey mind. I'm gonna borrow that. So you mentioned that sometimes people are coming in with the like signs of stress or environmental. Are you able to decide like what the actual triggers are?
Depends how much the client wants to get into it. So a lot of times I can hear and listen, and I'll ask key questions to try to figure out if they've had certain exposures. But toxins, I mean, they're pretty ubiquitous at this point, so they're everywhere. So I just try to, more than because the thing that I don't love that's happening now is we're getting scared to live in the world that we're in. And I actually think that our bodies can evolve and support what's going on, but I think we can make good decisions as well. So stop drinking out of plastic, stop eating or drinking out of cans. Just what products are we putting on, things of that sort. So I don't want people to be nervous that they're toxic. But to answer your question, we can determine. It just is, does the patient want to kind of go that route, or do we just want to support detoxification in general?
So speaking of the patient, let's talk about their experience when it comes to getting diagnosed, treatment, and the long-term evaluation of that.
So the experience would be that I kind of went through on our last podcast is, I like for clients to really kind of know what's going on in their own bodies. So if you can listen to some of the things that we've shared today and see, are any of these things relevant for you? Then that's kind of the step to decide, are you ready to, address these issues and evaluate these issues? So that's the first step. Second step is find a good functional or integrative medicine doctor, and preferably someone who's certified from an organization that is pretty reputable and well known in the community. The third thing would be then to have that initial consultation, which generally is going to be anywhere from 60 to 90 minutes. And that is really a partnership. It's a collaboration where the provider is really trying to get information from you and really understand what's going on for you and what's most important and relevant for you right now. So I might care about, I don't know, decreasing inflammation, but you may just need to sleep. And so we want to know that and understand, like, how can I help you first? How can I best serve you? Then the next thing that we're going to do is then order a very comprehensive lab panel where we're going to look at those hormones that I mentioned, those hormone levels, along with a couple of other hormone levels that I won't go into detail about today. And that really helps us to know, along with all the information that we gather, where are you in your reproductive life cycle and how best to support you. And then after that, the labs are back, we review those for about anywhere from 45 to 60 minutes, explain every lab value and how it's relevant for you, how to do something about that. So I'm not a big advocate of just sharing information without, something to be able to, some sort of solution to be able to help you turn that around. And what I want to say is I've not seen much that you can't turn around and support, at least improve. And then we'll have a discussion about what's available to you in terms of hormones. And then you ultimately make the decision. But I do want to make one distinction. So there's HRT, hormone replacement therapy, and then there's BHRT, bioidentical hormone therapy, replacement therapy. HRT is for anyone, which is most women I see, who've heard anything scary about hormones, that's usually regarding HRT. And generally that doesn't have to be, but largely that conversation is around non-bioidenticals. Bioidentical means that it's a hormone generally coming from yam or soy that's made to look identical to what your ovaries made or are still making. And that is more compatible with your body and your health. So the hormone system is a lock and key system. So it needs to be exact. It needs to click in all the different aspects that are specific to humans and women specifically. HRT does not have to be bioidentical. It can be just synthetic hormone-like, human hormone-like substances, but it's a lock and key system. So it may just click it that way, but not get this one down here. The problem with that is with all the research that we found, when you use non-bioidenticals, namely Premarin coming from horse's urine or synthetic progesterones called progestins, that turns on problems that we don't prefer. So generally, a lot of the stuff in the horror stories that you've heard in terms of cancer and things of that sort, that is coming from non-bioidentical hormone therapy.
Wow. And so do you have a preference?
Absolutely. I only will do BHRT. I won't use none. And that doesn't mean that you can't get them from your local pharmacy. Some of them you can, just the dosing can't be tailored as much. It just means we're not going to use something that's meant for a horse on a human, or we're not going to use a synthetic on a human that is not the same as what her body was making.
Okay. And is this pretty common in functional medicine, or this is like provider specific?
No. I don't know of any functional or even integrative medicine. I don't want to say completely because I'm sure there's someone who is, but it's really well known that you want to use bioidentical hormones because of the way that our physiology, our bodies accept hormones.
Okay, great. Let's talk about the different treatment options.
So depending again on what phase of the reproductive life cycle a woman is in, if she's earlier on and just having PMS, once we look at the levels, generally if any hormone is needed, it's going to be progesterone. A lot of times in a really young woman, because I see really young women in their teens or 20s, it's not needing, there's no hormone needed. It's addressing environmental stuff, nutrition, supporting detoxification. So generally my teens and young 20-somethings, very young 20-somethings don't need anything. If I see something like PCOS, which is polycystic ovarian syndrome, where you get like hair growth, hair loss, weight gain, insulin resistance, then that's a different conversation. So that's young women. Women who are maybe in their 30s, not quite into perimenopause, but maybe trying to get pregnant and it's a little bit more difficult, I'll look at the progesterone, or if they're having a lot of PMS, and that typically is going to be what they're needing first is progesterone. Then as we get on, maybe some women will need testosterone. My late perimenopause, menopausal women generally are going to need estrogen, progesterone, and testosterone. The way that I typically prefer to do the hormones best in women are creams. There, except for progesterone. I do like progesterone orally if a woman will take a pill, because when you take it orally, it creates a intermediate metabolite, so an intermediate substance that supports sleep. And that's one of my biggest complaints in my clients is sleep. So that's the only hormone that it's ever safe to take orally. The other ones, they cause toxicity in the body. And then testosterone. And so estrogen, progesterone, and testosterone in late perimenopause, menopause, depending on the levels and what the patient, is needing at that point, family history, personal history, etc.
Okay, so creams, a pill. Are there any other options?
Other options are pellets. So I've done many pellets on women as well. So that's definitely an option. Injections with women are becoming a little bit more popular, in particular testosterone injections. That is an option as well. But the ones that, the main ones that you'll hear talked about for women are usually either creams or pellets.
And I'm just thinking, if I know my mom is like, why would I want to inject myself with testosterone? I don't want to be no man. How do you
I mean, it would be it's very difficult. So the levels that we give women are like a fraction. We have to get like a tiny, tiny, tiny syringe, and you don't do it very often. So remember I said for men, you do it twice a week. For women, maybe twice a month, if not monthly, if you do an injection. A cream is different though, because it has to get through that barrier, which is trying to keep things out. They'll be done either once or twice a day, depending on the patient's readiness to kind of apply it.
Speaking of readiness, do you find that your clients are pretty adherent to the twice a day?
No. No. So that's why, most of us will just allow for once a day. But some who are pretty motivated, like if they're having hot flashes at night, I tend to like for women to put estrogen on at night so that they stay asleep and don't have a hot flash.
Mm.
But if they're really going through it, they'll be more motivated to do both times. But it does an okay job doing it once a day, especially if people address those other core areas of the functional medicine paradigm. They're working on their gut health, they're working on detoxification, they're working on their their immune system, we call it energy, but that's mitochondria. They're working on their cardiometabolic health. So when you're addressing all those other areas, they really do integrate and help you to have an easier experience in another area.
I see. And so for the pellet injections, it's just like when we talked about the men, area of muscle.
Same area, much lower dose of testosterone and even the estrogen. I mean, men don't get estrogen, but it's a small dose of estrogen, even in menopausal women. It's not a lot, but it doesn't last as long in women. So we do them about every 3 to 4 months in women.
And most people are getting it done in the thigh?
Yeah, with the glute, the lateral glute.
Okay. And the cream, where is that being applied?
I like upper body and neck. So wrist, here, over your bicep, top of your bicep, front of your shoulder, upper back. It's closer to your heart. I used to have my clients do it a lot on the lower body, but we started finding that it stopped absorbing as well. So I kind of have my clients stick to the upper body.
Okay, this is a great place to talk about side effects.
Great question. So side effects with testosterone would be most commonly are acne, and less likely is going to be hair thinning at the crown and temple. So crown and temple. Water weight gain, but that's usually transient unless the dose is too high. And then we have to technically talk about mood, because if you do too high levels, which generally most functional medicine doctors don't, it could lead to too aggressive of a mood. But those are some of the more common ones that you'll see. And the other common one I didn't mention was facial hair. But usually facial hair and acne are the ones most people are going to see. And all you do is just adjust the dose if it's bothering the lady. For estrogen, if she still has a uterus, for both estrogen and progesterone, they're kind of similar. You can see an initial breakthrough bleed. So it may look like they're having a period again if they are menopausal, because you're starting to stimulate that tissue. That should go away after time if they keep doing both of the hormones. So that's something that we make people aware of so they don't get nervous. Breast tenderness initially can happen too because we have estrogen receptors and progesterone receptors in the breast. You can see that also is usually transient. If the levels aren't right, you can see weight gain. And then those are probably your more common ones that you would see with estrogen and progesterone. And then the biggest one we leverage, which is with progesterone, is sleep. So we leverage that and have you take it orally because it's sedating.
And are these covered? This is out of pocket?
You can get some of them from a conventional pharmacy. You just can't tailor the dosing. They only have a couple of doses. So it's hard to really kind of get that sweet spot for that individual woman. And sometimes you can't get the dose up high enough, or you can't get the dose low enough, depending on where the woman is.
So are they going to like a compounding pharmacy instead?
I largely will use a compounding pharmacy because they can tailor the dosing a lot bit better than if you just do a conventional pharmacy script.
And so that's going to be out of pocket, right?
That's out of pocket. They're not extravagant in price. I don't want to quote your price, it's specifically, but they're, depending on where you are, they could be affordable, but it is an out-of-pocket expense. And a lot of my clients, the way they swing both the visits and the supplements and the hormones is to really double down on their Flex account so that they can use that.
Oh, great tip. So what are some contraindications or reasons why someone wouldn't be a good candidate?
So for women, I would say if any active cancer, again, in particular, if you have a strong family history of breast cancer, there needs to be a very involved discussion to figure out. It's not a contraindication, but a relative contraindication, because there may be, a reason that we don't want to do it, but it actually could be more protective to do it depending on the person and what their genetics and et cetera are showing. Another contraindication, again, would be unstable cardiovascular disease. It's not a contraindication. You just don't want to be putting someone on hormones whose cardiovascular system is not stable. And then if a person actually had breast cancer, there's certain hormones most functional medicine doctors probably won't do. Testosterone has been found to be breast protective. So that is one, once they've completed treatment, that sometimes we'll consider.
Wonderful. And then any common misconceptions that you hear about?
The biggest one is that hormones cause cancer, in particular breast cancer. And that came out of when I was speaking earlier about a lot of research around non-bioidenticals. So either Premarin or synthetic progesterones called progestins. The research initially came out and scared people that there was increased risk of developing one of the big ones that's still lingering is breast cancer. And estrogen is not going to promote breast cancer itself. Now, with that said, we're not going to give it to someone who has active breast cancer, but that's actually not the problem in developing it. It's either using a non-bioidentical toxicity, metabolic health. There are a lot of factors that are going into that. But progesterone's breast protective, testosterone's breast protective, and estrogen, it to some extent can be breast protective if someone doesn't have an active cancer.
And how far away would you be referring to as active?
So we would want somebody to be in remission with their oncologist. So they need to be through treatment. So that's anywhere from 3 to 5 years. We would want them through treatment and they're kind of in the clear.
Okay, great. Yeah, my mom has come on the show multiple times to talk about her experience with breast cancer. And so those questions are very personal when I ask those in terms of because she has symptoms and things like that that are just interesting to see whether or not hormone replacement would be of any help to her. And of course, with her being my first degree relative, that would also put me in a category of, being cautious.
Absolutely. But a good functional medicine doctor, because I can't go into it as much, can really get in the weeds with you and actually really explain what these hormones do and go through the data. They actually never put out a retraction to those studies that actually initially said that these hormones were potentially supporting cancer. It has happened, but it just didn't get press. So if people want to go do their due diligence, it's out there. It just didn't get any media attention. However, you will see more and more. There are a lot of celebrities and people who are really taking the platform and really speaking about their own personal experience with hormones, and a lot of the misunderstandings that have been perpetuated out there about bioidentical hormone therapy. So I think the message is getting out there more and more that you do want someone who knows what they're talking about to be able to really appropriately evaluate if you're a good candidate. Because I'm not going to just put someone on hormones just to put them on hormones to make their hot flashes go away. It needs to be a good fit for you. So you want someone to really be able to navigate that with you.
Yeah, I think those are great points. And as I mentioned in the previous episode, and that you brought up a really good point, is if you do identify as transgender female, that it's important to ask your provider if that's an area that they specialize in and have gotten an extensive training in, because not everyone who does hormone replacement therapy has that background.
Absolutely. And you don't want somebody learning, that intricate of a wellness plan, without some significant training to really help you navigate that. And there are a lot of experts out there who really do that. So I would just look to find some of them.
Perfect. What are 3 takeaways for my episode today?
Oh, let's see. So I would say first, really just letting go of some of the memes that we have around getting older as a woman and hormone health in general. I think there's a lot of misinformation, fear about getting older, and then fear about a reproductive cycle in general. So I have friends who hate their menstrual cycle because of the pain and the different experiences that they have. And I want people to love it because it just is one of the things that is part of our superpower. And then even when we move into menopause, to love the absence of it, because that's you're birthing another experience or type of window of creating in your life. So I think, looking at the memes and let some of those go. Even pregnancy is a big one. When you get to a certain age, you can't get pregnant. I can't tell you how untrue that can be. Not for everybody, but that can be. So just look at some of your beliefs around being a woman and your reproductive health, and really look at, is that serving you, and start to really do some interpersonal work with that. So I think that would be the first one. I think to go along with that, to really enjoy this experience of being a woman, because it's really very unique to be able to give life to another human being. That is a very reverent and just it's a privilege. It's a high experience to be able to have the opportunity to experience. So really love that and embrace that, because that's the experience that we're having now. And then finally, I would say for my women in particular, trust yourself. You know what I mean? Listen to that. It might be right now, a small, quiet voice, but allow it to grow more and more through meditating, being in nature, sitting on the ground in particular, and grounding. All of that, connect to that, because as women, we're definitely connected to, nature, the divinity of the earth plane. And so really just center yourself so you can hear what you really have to say, because you're wise in ways that is beyond anything that probably in this moment, even I for myself can comprehend.
Have you created any audio content, either in an app or audio book? You have a great voice, and I just love I would love to hear your affirming words every day.
I haven't. That's one of the things that I'm going to be doing. I'm also going to be doing a series of wellness webinars where people can just listen to them. Where I'll put one out every week or every 2 weeks, where I'll give very specific recommendations, not necessarily tailored, but give you more help along the way. But I appreciate you saying that.
Where will we be able to find this content?
So if you send me an email to Dr. Nayo Wills, DRNAYO Wills @gmail, I will put you on my list. I have a database of my clients that I work with, and I send out newsletters. And so when I have that up and going, which should be in the next couple of weeks, you'll be on my list and you'll get my my newsletter that has all that.
Perfect. And are you accepting new patients?
I am. So I try to keep it a little bit on the smaller side. So if you want to get in, definitely I welcome you, but I limit so that it's not I want to be able to spend time with people.
Okay, and we'll put your information in the description box. Will they just visit the website and schedule an appointment?
Or shoot me an email. You can also just call me. My number I'll provide as well. So whatever medium works for you, just communicate.
Wonderful. You're so approachable.
Thank you.
Well, we thank you so much for spending not one, but 2 episodes with us explaining a topic that's can be a little complicated, can be a little intimidating too, right? Because there's certainly a lot more areas we could have gone into, and there's a lot more that people can learn about. But I think you did a really great job laying down the foundation and giving people the language that they can bring to their provider to say, hey, this is how I've been feeling, and this is what I think might be the problem. And I heard about these other treatments. Can we talk about them? See if I'm a good fit. So remember, everyone, you can email us your questions or show ideas to tmi.melanin@gmail.com. If you haven't already, please subscribe to our YouTube channel and follow us on every social media platform. Say hello in the comments when you get there. Share the show with your friends and family and rate us on the Apple and Spotify podcast. It's your way of supporting the show and getting the message out there to those who need to hear it. All the resources that we brought up to it today, as well as our social media links, will be in the description box. Remember, we release a new show weekly on Sundays at noon Eastern on YouTube and all your favorite podcast apps. It's been a pleasure, Dr. Nayo, talking to you twice, getting to hear about your journey and really experiencing what it's like to sit down with you for 90 minutes or longer and really understand what's going on, not only internally, but externally, and what we can do about that. And that there's something we can do about it.
Absolutely. Thank you so much for having me, Dr. Kimberly. I really enjoyed your energy and just being with you.
Thank you. And I really love how much you respect the getting on process and your choice of words for that. I really appreciate that. I'm going to adopt that.
Awesome.
Thank you, everyone, for watching. We'll see you next time.